Welcome back to Healthcare for Teens, a channel dedicated to helping teenagers understand more about the different areas of healthcare. Today we have with us Sirey Zhang, a fourth-year medical student majoring in anthropology at Dartmouth's Geisel School of Medicine. Siri, thank you so much for being here with us today. It's an honor to have you on the channel.
Thanks, Avi. It's really great to connect, and I'm really excited for this.
And to kick off this interview, I'd like to first ask you, what drew you to the field of medicine and more specifically anthropology?
Yeah, that's a really good question. So I think, like a lot of people who might be accessing this platform, my journey to medicine started pretty early on. It was in high school when I first got a little bit of an interest in health equity and global health. I was really lucky to have had some exposure early on working on some projects in Kenya and some healthcare infrastructure projects. But I would say back then, my understanding of health equity and global health was pretty naive. One person that was really inspiring to me, and I think a lot of people know who are interested in global health, is Dr. Paul Farmer, who passed away last year. He was an anthropologist and wrote a lot about the intersection of culture and other social forces that impact health and well-being. So I entered college and I decided to study anthropology because I knew about the work that he did. And what was really fascinating through anthropology was learning about all the ways in which healthcare is impacted by culture, by social forces like politics, economics, um, culture, etc., and how it really extends beyond just whatever biological thing is going on in someone. So, um, for instance, it can mean one thing as a doctor to offer the right treatment for someone for some sort of diagnosis, for instance. But for an individual, a lot of things go into play. How is their diagnosis impacting them personally? How is it viewed amongst people in their community? All these things are really, really important. And I found a lot of meaning in anthropology in my path towards medicine.
And what stuck out to you about Dartmouth as compared to other schools when you were applying?
Yeah, Dartmouth is a really interesting place because it has a really strong medical anthropology department. There are some great individuals who work very closely, who are anthropology professors who work with the medical school as well as the School of Public Health here at Dartmouth, looking in their research primarily at how anthropology can support healthcare professionals, but also impacting health as a whole in our country and also across the world. There's some really interesting research going on. For instance, one of my research advisors when I was an undergraduate student here at Dartmouth really looked at how substance use and mental illness impacted the local community around the area, thinking about how where Dartmouth is a very rural location can often exacerbate a lot of the impacts of substance use as well as mental illness because it's small communities in this area and the social implications of having a diagnosis like that often are very broad reaching. And there's a strong intersection between community support, the income of the town that you live in, all these things in regards to how we can best help someone with those needs.
Siri, what are some of your most memorable moments from med school at Dartmouth?
Ooh. So one thing that was really exciting as a medical student when I started medical school was being able to participate in some of the COVID-19 vaccine clinics. I started med school in 2020 when the pandemic was first kicking off, and it was really challenging because we were removed from each other, but also from the communities that we were sort of learning within. Um, we had very few opportunities to engage with the community to sort of build our clinical skills. And one opportunity that really jumped out was the ability to participate in the COVID-19 vaccine clinics. So the med students were given training to administer the vaccines. And that was really my first experience where I was able to finally interact with people in the community and talk to them after, learning on Zoom for so long. It was incredible because everyone showed up to their appointments really excited. It felt like we were really part of something bigger, and that was really, really meaningful. So when I look back on the last few years, that's something that really sticks out to me.
And as of now, what do you see as the most pressing issues facing the healthcare system today? And how do you envision addressing them as a future doctor?
Ooh, yeah. I guess back to the COVID related thing, I think the pandemic really showed us really the inequities that exist within our healthcare system in the United States. It's really fortunate that we live in a place where there is so much innovation and access to technology in the medical field. But at the same time, for the United States, which is the country that spends the most on healthcare, our health outcomes really pale in comparison to other high-income developed countries when it comes to things like life expectancy, maternal mortality rates. Despite spending many times more than other developed countries around the world, our metrics lag far behind. And a lot of these inequities stem from systemic related things like systemic racism, sexism, et cetera. And these things are really ingrained in our society, in our healthcare system, and really should be addressed more effectively as a healthcare professional. I think what's really impactful as someone entering the field of medicine once I graduate from medical school is the voice that you'll be able to carry in your community, but also on a larger platform, whether it's in your city, state, country, et cetera. There really is a need to really bring to light a lot of these inequities and look at how other countries, for example, are solving these inequities. With our current system, with private insurance, with for-profit healthcare, I think these are really aspects that hinder the best outcomes for people, especially those who are from marginalized communities. And having a voice once you're in your field and practicing, I think is really, really important.
And how has Dartmouth prepared you for the realities of practicing medicine in a rapidly evolving healthcare landscape?
Yeah, so for anyone who's interested in applying to medical school or looking at a career in medicine, the med school here at Dartmouth is really, really unique in that the training sites that are offered expand all over the country. So typically in medical school, your first 2 years are your preclinical learning years where you're in the classroom. And then in your third and fourth years, that's when you do your clinical rotations. You do the large rotations like many, many weeks of surgery, medicine, pediatrics, psychiatry, et cetera. And at Dartmouth, instead of just staying at our home institution where our home teaching hospital is, like many other medical schools do, we actually have opportunities to rotate all over the country. So in my third year, I did surgery here at Dartmouth, but I did internal medicine in San Francisco at a busy hospital there. I did pediatrics in the Navajo Nation through the Indian Health Service in Fort Defiance, Arizona. And it really just showed me that this sort of diversity of learning environments that Dartmouth offers, I feel has prepared me to become a better resident and a better physician in the future. It's true that wherever you go, a lot of these diagnoses are similar and the way you treat them are the same. But with my anthropology background, I've come to realize that these diagnoses exist in their unique context, whether it's cultural, social, et cetera. And the way that a disease might impact someone's life really depends on where they live, whether it's in an urban or rural area, et cetera. And I think having these opportunities really prepared me well.
And Siri, you just came back from Rwanda, so could you discuss a little bit about what you did there?
Yeah, so I spent 4 weeks in Rwanda on a research project there looking at how to improve equity in global health medical education. There are strong movements in global health to make academic global health more equitable. And that's because historically, a lot of the resources that have been given to high-income countries to do global health have been inequitably distributed in the sense where most of the research is produced by authors from high-income countries where most of the students who are able to participate in global health exchanges are from high-income countries going to lower middle-income countries. So historically, that's been very inequitable, and there are lots of advocates in the global health field who really want to make it more balanced so that it can benefit everyone as much or benefit those from low and middle income countries more because of historical marginalization through colonialism, neoliberal economic policies, et cetera. So I spent 4 weeks there, rotating there in the clinical wards in pediatrics, all the while getting to know a lot of the medical students there from Rwanda. We interviewed them, really trying to gain their insight on what their experience is like working with visiting students. There are some problematic aspects that high-income country students can carry, like entering with a savior mindset, which is often common in global health, or entering in a very I just want to see what happens in a low resource setting type of way, which really benefits the learner from the high income country. And in the process of gaining their experiences of what it's been like working with visiting students from the US, for instance, we can offer recommendations on the type of learning or the type of cultural humility training that students from high-income countries can sort of prepare for before they do a global health rotation. And on the flip side, since we want to get more students from low and middle income countries to rotate in the United States, really understanding what they think that they can get the most out of a rotation here in the US, for instance, how it can benefit their learning and their careers the most. So that was the research project that I was working on, and it felt really fulfilling to sort of give back to the global health community.
So was this your first international trip?
No, for Rwanda, I spent 7 months in Tanzania doing a research project, interviewing people in terms of understanding how Tanzania's culture and history impact the current healthcare environment. I interviewed doctors who specialize both in Western medicine as well as traditional and folk healers. And I interviewed patients to really understand what sorts of decisions they made when it came to being sick. It was really interesting learning about how people viewed the benefits and drawbacks of each type of system, whether it be Western medicine or traditional and folk medicine, and really tried to understand how people found meaning in their healing process. And then furthermore, Dartmouth has offered me a lot of other experiences. So after my first year of undergrad, I went to Cameroon for 10 weeks to study vaccine hesitancy. So I've had all these great experiences under my belt, and it's really thanks to the great faculty here at Dartmouth who have offered me those experiences.
And so you're at the end of medical school, and how do you prioritize your well-being? Obviously, medical school is known for being very rigorous and challenging. And what strategies have you found most effective in managing stress?
Yeah, for me, it's all about the people. So my favorite hobby is cooking. I love food. So maybe my favorite hobby is eating and then cooking afterwards. But my favorite thing is to cook for other people. And that's something that I prioritize through all 4 years of medical school. Um, Whenever I can, whenever I feel burnt out or tired, I try to get some people over and I try to cook a meal for them. And that's really sustained a sense of community with my classmates, and it's also really fostered my well-being. So finding that one thing and really making time for it to uplift myself has been really, really important in terms of keeping my balance, etc.
And as you approach the end of med school, what are some valuable lessons that you've taken away?
Well, definitely the thing earlier about really fostering community. And another really big thing, I mentioned this a little bit earlier about rotating at different clinical sites, whether it's in the city here in rural New England where Dartmouth is, or in the Navajo Nation. Um, what's really, really been important to take away is that it's important as a medical student to learn about all these biological processes that make up the diagnosis. But at the end of the day, it's a person that's impacted by this diagnosis, and that this person exists within their communities, within their families, etc. And the real thing that you're looking in front of you is not whatever diagnosis you give on someone, but the person with that diagnosis, and really centering that person and trying to understand their context, their needs, their background, their thought process, etc., is really the most important thing.
What advice do you have for those applying to med school and planning to become, a future medical student like you?
Yeah, definitely be authentic to yourself. If you're interested in medicine, that's for a very specific and good reason. And be authentic to that reason and never lose sight of it. It's a really arduous process to get the pre-med courses done, to prepare for medical school, to apply and get into medical school. And in that process, it can, really wear down on you. And remembering sort of the reason why you're there, whether it's an interest in research that you've had in the past, whether it's really strong desire to work with people, whether it's prior experiences that you had working in the medical field that really inspired you to go into medicine, really centering that is really important because losing sight of that can just wear you down even more quickly.
For sure, for sure. That's it for this video. And Siri, thank you so much for being here with us today.
Yeah, thanks, Avi. I really appreciate your time.